I'm Dr. Sujatha Thyagarajan, Senior Consultant in Pediatrics and PICU at Aster RV Hospital, JP Nagar, Bangalore. Today we want to talk about autism. I see many parents feeling very shocked and surprised when we pronounce autism, and it's important to try and see how we actually identify that and also see how we can support that. So the first thing that we want to see is, when is a typical age of presentation of autism, okay? What normally happens is people get the label of autism usually close to 3 to 4 years, but actually there are early pointers, there are early warning signs, and I would urge most all the parents to actually look out for their young children, say in the age of like around 1 year to 18 months, have a look at how they perform. So the key problem in autism is social skills. So majority of the times you will see a child, a happy toddler, smiling, looking into your eyes, following whatever you say, and they may be pointing. For example, you say point out to the fan or point out to the head or the body parts. The children happily do it. But if your child is unable to maintain eye contact, is unable to use their pointing finger, not able to point various items, or following or meeting your eye contact. For example, you look into something and is the child following you in looking at those objects. So these are the key things that I want you to identify, and this happens usually in the age of 12 to 18 months itself. So these are early warning signs. If you do identify that, have a chat with your pediatrician. Normally in your developmental follow-up, these are identified by the pediatricians during your routine immunization visits. The other thing is people generally tend to worry about, oh, my child is not speaking. So the key thing is, are they able to speak meaningfully some monosyllables? So by 9 to 10 months, a child must be able to say like mama, papa. So some children may or may not actively do it, and those are the things that we need to recognize. So for example, a child is not able to speak, but how do they express? So do they express non-verbally? So I have heard parents saying that, a normal toddler would actually say, would point out or would drag the parent into whatever item they want, and that's their non-verbal way of communication. And if you find that your child is unable to do that non-verbal communication, so that expression is not there, that is a concern, that is a red flag, and you need to consult the pediatrician there so that we assess that child for these symptoms. So as early as 12 months to 18 months, one is able to pick up these signs, but it tends to become more, the pattern becomes more established by the time it is 3 years. Now, it is very important to recognize that even if your child is a bit older and shows certain signs, but not every sign is there, then it is not about the child's intelligence. Autism is not about intelligence. Autism is about social quotient, emotional quotient. They are not able to recognize the emotions of themselves or of the other person. They do not maintain eye contact that often. They are not able to connect with you. Their speech is often delayed because they don't know how to express themselves. The non-verbal communication is very much restricted. Predominantly, they may just have a random cry or a frustrated, irritated cry. You may see them flap their hands, or their common expression is more of that agitation, and that's what I just want you to recognize, okay? In terms of making this early diagnosis is absolutely vital, because early intervention provides better outcomes. So have a think about making that early diagnosis. So on this World Autism Day, I would urge all the parents to have a look at the early warning signs and consult the pediatrician if they are concerned about these signs.